You're listening to the Belmar Bites podcast, brought to you by Belmar Consulting. All right, welcome back to the podcast. I am excited for our guest that we have today. Tom, thanks for joining us. And Matt, you're coming in, you're tagging in. We get the opportunity every so often to both interview customers. So this is going to be a fun conversation. And so, Tom, we're grateful for your time and thanks for joining us. Well, why don't we kick things off with an introduction, and love for you to introduce yourself, a bit about your background, and then we can get into talking about the organization that you're with.
Sure. My name's Tom Zazueta. I'm the Chief Operating Officer of Valley Health Foundation. I've been here for about a year, and Valley Health Foundation serves our public hospital system. In the state of California in the U.S., we have, our state has an obligation or has mandated that the counties in our areas have the obligation to actually take care of and have a place for everyone to get care that needs it, regardless of insurance, regardless of anything. So what we do is we actually help support these public hospital systems within our county. So when Valley Health Foundation was founded in 1988, there was one county hospital that is, in fact, I think the oldest hospital in our area. And then since then, that was 1988. So since then, we've actually grown quite a bit as an organization and as a hospital system. We now have 4 hospitals, 15 clinics. We serve 1 in 4 people in Santa Clara County, which is about 1.9 million people. So it's a great organization that really helps be the safety net for people that don't have the care they need, as well as provide best-in-class services for things like our burn care is some of the best. Our trauma center, we're a level 1 trauma center. We have a lot of great areas of excellence that we like to also showcase that we do here within the hospital system. But our job as Valley Health Foundation is to raise funds, private money, to actually help fund and keep those different programs afloat and give them additional capabilities and things that they might need to help elevate the experience for the patients who use us. We like to think of ourselves as a two-sided marketplace. So we have the donors that we care about, and then we also have the beneficiaries that benefit from those generous donors. So for us, it's, managing those two. We're trying to connect donors and beneficiaries to make sure we're providing a place for people to give, and then a place for people to get make change and make impact. So that's what we focus on here.
Yeah, that's awesome. Awesome. Well, let's chat a little bit about your journey to Valley Health. I know we've had the opportunity to meet in person and have some conversation. You told Matt and I your story, and it's interesting. So what was the journey? Go back as far as you want in terms of career path, but what was the journey that led you to Valley Health?
Yeah. So I should probably mention that, if you're not familiar with the geography of California, Santa Clara County is actually the heart of Silicon Valley. That's where Silicon Valley companies have all grown up. And I was fortunate to be living here and fell into that space. So I was working at Apple early in my career, worked at a number of startups, have a lot of my time has been focused on technology. I've also done a lot of marketing. And so it was probably about 4 years ago that I joined the board for Valley Health Foundation. One of my friends was on the board and said, "Tom, you got to check this out." And I was very fortunate to have joined the board and learned a lot about what they were doing. It was actually a blind spot of mine. And I think for a lot of people in this valley to know that we have this public hospital system that is so great and takes care of so many people. But for those who are not in that space, you just don't know about it. And so I got to learn a lot about the good work they're doing here. And while I was on the board, after about 3 years, it was evident that there was some need as they were starting to do some a digital transformation, basically up-leveling a lot of their systems, that there was a need for a chief operating officer. And the timing for me worked out perfectly with the startup that I had just finished with. They were still going, but there was a time for me to exit. And so it was perfect timing. And I was able to join and help with this new digital transformation. And I'm sure we'll get into more of what that is and later, but that was kind of the start of how I got here.
So Tom, I want to double click on that because I think your path is very interesting, and I know you and I have talked a lot about it. But to go from for profit to nonprofit, what was that journey like in terms of just going from this startup mentality to non? Was this the first nonprofit that you've worked with?
This is the first nonprofit I've worked for. I've been on boards before for different nonprofits.
Right.
But what's interesting to me is, I've worked at Fortune 500 companies and I've worked at small businesses. And to me, a nonprofit, at least the one I'm in now, feels much more like a small business. So there's not a huge difference other than, you're mission driven and the things we do. I mean, the reason I'm here and the reason I love being here is the mission that we have, which is to serve people and, to strengthen our healthcare for all. Um, so I think that's the motivating factor. So there's a real purpose to the work we do, but the way that the organization operates, the challenges you have, it's just like a small business. We're trying to figure a lot of stuff out that you would figure out in any small business. So that part's not
Right.
different. It's maybe the motivation and why you get up and the things you do is different. But other than that, I feel like it's just like any other small business I've worked for, a startup.
That's cool. Tom, you kind of introduced the idea that you were on the board. You had a view into digital transformation that was underway, and then you stepped into an operational, day-to-day role. What can you speak to, like, from a digital transformation perspective? What were the, I mean, I'll call them challenges. What was going on in the organization that prompted transformation? And maybe you can give a bit of history in terms of, like, how far back was that, and where are you at today on that journey?
Yeah. So it was about 2.5 years ago that the digital transformation project kicked off, where we spent about 18 months prior to launch to kind of get everything going and built out, and then launched about a year ago. Um, the the process for that was that we, as I mentioned, our hospital system has grown quite a bit, and so we as an organization have also grown. And so it got to the point where the systems and the processes that we had weren't sustainable to continue our scale and growth. So there was a need to actually up level the foundational elements that help us manage as an organization. And so we picked Salesforce and NetSuite as being that core foundation to start building on top of. And that's a pretty ambitious project to start, a small business to go after changing everything you've done in the past to two new systems at the same time and trying to get them to integrate and work well together. So that's where I kind of came in. We launched, and there's still quite a bit of work to do to get things working smoothly, but we've made a lot of great progress. I didn't get into all the details, but we raised about $20 million on average. And with that, we have about 200 different funds that we manage that are specific to help care for certain areas of the hospital. As I mentioned, the burn unit or our NICU unit or whatever, people might be giving to those particular causes. So we have these funds that we manage. And so with our Salesforce instance, we've actually built out a donor portal that will allow, and it's not quite up yet, but will allow our fund managers, the people, the doctors, or the people who are in charge of those funds, they have the discretion on where that money gets spent. They'll have a place and a portal using Experience Cloud to be able to log in, see their totals, see how much is left in their funds, see where the fund requests have come from, see where the money's gone and where it's going and how much they've spent to date, all that kind of stuff. So it's really a transformational part of our business that before people did not have access to and would not be able to see. And so that's a big change. We manage all of our gift donations and all that stuff through Salesforce. It's becoming the hub that we use for everything that we do in the organization. It's, a major shift. And so we're still in the process of making those changes and getting it ironed out to be as smoothly well-oiled as we can. There's still a few hiccups that we're managing through, but it's been a great process so far. And there's a lot of work for us to still do. And we see a lot of potential for where we can take it. I mean, I think with Agentforce now, the idea of having AI tied into our Salesforce instance is going to be a game changer for us. And we can't wait to get that to happen. We just need to kind of figure out the basics first before we dive into our next phase of this. So pretty exciting stuff.
Yeah, Tom, on the notion of change, I mean, that's a big project to undertake. Lots of change. I'm curious if you can speak to just organizationally, like what were those indicators that the organization was ready? I know you said processes weren't matched up with some of the goals that you had, but maybe just organizationally, culturally, what did you notice, and how did you know that the organization was ready for that big change?
I think it was a matter of we had to do it. We were getting big enough where we could, the way that we had done it in the past just wasn't scaling. And so it was getting to the point where, getting out acknowledgement letters would take weeks or months sometimes. And there became a clear indication that we need a different way to do this because we can't keep up with the way we're doing it. So let's figure out another way. Um, so because of that, we decided to go all in and go and do it the right way and build the right foundation. And so I think picking Salesforce is the right direction for us. It's just there's a lot of things that, I mean, we have a lot of moving pieces that we have to figure out, as I'm sure most organizations do. Tons of integrations. We're using all sorts of tools to integrate within Salesforce as well. So when we do an event, there's different event software. When we do fundraising, different fundraising software. There's marketing campaigns. There's just so many elements that go into all of this. But at least having one hub where we can have all that information reside is the goal here. And we're also going to explore going with Data 360 because we think there's so many other pieces of information that we need to aggregate into a single place so that we can have better reporting and metrics, not just the Salesforce side. So yeah, it's exciting, but it was mainly done so that we could scale the organization. It was pretty clear that we needed to make a change, and we're fortunate that we had a board that supported that and supported us in growing and investing in this change because it's an investment.
Yeah. Yeah. Tom, I think Matt's question, I'd love to just expand on that a little further because we have conversations on a regular basis with leaders and organizations that are thinking about embarking on a change. And you've got the board, you've got the executive who have a big picture. They understand what's going on. They understand where the organization's going, and they recognize they need to do something to get there. But you've got people in the organization who may not have that view. And so walk us through, how did you manage that with the team? How did they respond to it? And just some tips and tricks, I guess, that you can share with those that are at that same spot that you guys were at a couple of years ago.
Yeah, I think, in some ways we're fortunate in where we're located. I think in Silicon Valley, there's this ethos of always wanting to improve and challenge yourself and grow. And everybody, change is hard and not everyone loves change. But I think everyone was pretty willing or excited to see what this change could do because they knew that things needed to change. It was just gotten to a point where it's like, yeah, we can't keep doing it the way we're doing it. So we're excited to learn about a different or better way. Um, so from a change management standpoint, by and large, I would say everybody was pretty much on board. There's still people that are going to hang on to their old ways of doing things. I mean, I should mention in the process of all this, we also switched to Google Workplace. We also switched to adding Rippling, which is an HR platform tool that we're using. We're using Ramp now, which is a way to do expense reports and do virtual credit cards and things. So we've added and using Asana and using Slack, and we keep adding new things. All of these things with the goal of making our way that we work better. And I think people have seen the changes, not having to do manual time cards anymore or not having to submit a manual expense report anymore. Now that it's all automated through your mobile phone, you get a receipt, you can take a picture of your receipt and it automatically gets connected to an expense report. I mean, there's so many things we've done to automate things that make life easier and make their work life easier. I think they see the benefits. They understand there's still some challenges and we still have a lot of hurdles to get over because we're integrating a lot of things, but we're trying to move fast. And it's been a busy first year, and I'm excited about kicking off our second year and really buckling down and getting Salesforce to the place we want to get it to.
Yeah. Yep. I think the question should really be, what have you not implemented, Tom? And I know I've made that comment, but as you rattled those off, it's just, wow, these are big projects to undertake. And I think you nailed it on the head in that the sounds like culturally it was already woven into the fabric of there's so much change happening in their direct vicinity, the community, that landscape. So maybe that change was a little bit easier. But I think I like the way you put it of people see the benefit of it. Like they see the what's in it for them. They feel the effect of it. And then that kind of coaxes people along and gets people to come along for the journey because who knows, maybe these are different tools and there's so much innovation. There's so many new tools and Salesforce is certainly a big proponent of innovation as well. So
Yeah, I think that's
I'm
just
glad you
it.
put it that way.
I think it's painting that picture of what this could be and what these tools will enable. Because I think everything we do is in benefit of both our workforce and our donors and beneficiaries so that they're getting benefit, right? We're building these tools that I don't know how else we could build this fund management portal where somebody would have access to see real time what monies are being spent in their fund, how to approve their fund requests. Everything we've built or we're building for those donors and beneficiaries, I think is something that's unique and people are excited about. So it's really painting that picture of what could be and getting everybody on board to go in that same direction.
Yeah. Yeah. That's great, Matt. I love how you phrase that. Like, what have you not adopted? But maybe just to click on that a little bit, adopting tools is great, but actually getting those rolled out and used and doing it in a sequence that makes the most sense. So, I guess Tom, when you step back, I mean, you've worked in technology throughout your career, so you've got some framing. But many of our customers that we talk to, they don't have a technology background, and so they struggle with the sequence, the order in which you do things. How did you approach that? Like you've brought in I'm thinking off the top of my head, you've got 10 different tools here that you've brought in the last year. There's an order, there's a right way to do it. There's, probably a wrong way to do it. So like how did you figure that out?
Yeah, when I first joined, I spent, I think, the first 4 weeks. I interviewed every single person at the organization, and asked them, what was working, what's not working, what are the challenges, what would make their jobs easier, how could I help, all that stuff. And I think at the end, I consolidated everything I'd heard and came up with a list of things that made it clear kind of what we needed to do. And the first thing I heard was communication. We needed to improve communication. I think, when the organization during COVID had a tremendous rush of work they had to do because we're, delivering all the PPE and kind of being the central place for the aggregation of all that. But a lot of people working from home. So all of a sudden, people that weren't used to working from home had to work from home. We didn't have the communication tools. We didn't have the ways to communicate other than through email and we are on the county system as well. So we have teams, and for our county, they require that the team's messages can only stay for 2 weeks. So if somebody sends you a message and then 3 weeks later you want to go find that message that they sent you, it's gone, right? So it became clear that like Slack would be a quick, easy win for us to make intercommunication, inter-office communication much more seamless and give us these watering holes to communicate and talk to as if we're in the office together. So that was a quick win. I was also clear that there was a lot of confusion on who's working on what and what's getting done and deadlines and all this stuff. So we quickly put in place Asana that was quickly adopted, and people saw the value in that because it allowed them to have a structure, allowed them to assign tasks, allowed them to create forms. I mean, there were so many wins that we got from that. Those were the two first things. In the meantime, we had been doing the rollout of Salesforce and NetSuite, which was sort of in parallel, but the initial need that I saw was really those two things, that communication and project management or order of, work that we do, was sort of lacking. And so that was the first thing we kind of shored up. The second two things that came was it was clear we needed a better way to track people's time, better way for us to track PTO, better way for us to track some of the HR issues. So at some of my startups, I'd use this tool called Rippling. We're now implementing Rippling, or we implemented it, and that went live in July 1st. And then the third thing, the piece of software that we did was Ramp. Ramp allows us to have these virtual credit cards and allows us to do our expense reports, and just simplified how we manage our finances from a personnel. And even this idea of virtual credit cards allows us to also allow some of our fund managers to have a virtual credit card that's assigned to and tied to their fund, so that if they spend money, it comes right out of their fund, which is a breakthrough for us. Makes it a lot easier for managing different requests that people have for spending the money from their funds. And sometimes it's small amounts, so it creates a lot of effort, or did create a lot of effort for our finance team to have to manage these small requests. Now it's much easier when we can give them a specific credit card that's for a specific item for their fund, and then they can go off and spend it, and the amount of work that's done by the finance team goes down tremendously. So.
Yeah. Wow. That's cool. Um, Matt, I know you probably got a question teed up. I'll let you go, and then I've got one, Tom, just in terms of your board.
Sure.
But Matt,
Yeah, well, I want to talk about data here, Tom. I know you're a data-driven guy, and for those who don't know, Tom tracks all the health data, all of those different pieces. So you're certainly in tune with
Yeah.
data, and I know we've talked about this. But when you think about metrics and how do you measure success, I appreciate you had a really good interview approach and understanding the pain points. But I'm curious how you've gauged? What does success look like, and how do I measure success for each of these different tools that you've implemented?
Yeah. So one thing we did was at the end of the year, kind of reflected with everyone on what we did do. And yeah, I think it's easy for employees to see or to not see all the changes we've made. So by reflecting and reminding them like, hey, do you remember that you used to have to do manual time? Or do you remember that you had to actually scan in your receipts, and then you actually had to fill out an Excel spreadsheet, and then you had to get it uploaded to DocuSign, and then you had to actually send that, like the whole process that they used to have to do, you sort of forget when all of a sudden now it's automated. You're like, yeah, I don't know what the benefit is. It's like, well, do you remember what you did? So when you remind people of all the pain they were in, um, they quickly, see. As far as metrics and how we measure it, that was more qualitative, just asking people how they feel. Does it improve their work life? Is it a better system? I think everybody would say yes. There's still, again, change management's hard. And so you still have some people still using Excel documents and emailing an Excel document. And it's like, I'm trying to explain that, by having a Google Sheets link, you can put it in everybody can see it. No one has to have anything mailed. It doesn't get, it's not old after you mail it. So there's a lot of benefits that are still, people are still grappling with. We actually just have spent, and this was the last 6 months of my role, was building out our strategic plan. So we just built our 5-year strategic plan so that we can actually have some long-term goals on what we're trying to do with the organization, how we're going to be structured, what are the 5 things we're focused on, so that we're saying no to certain things and yes to other things. Um, Along with that will become our annual plan. So each year we'll create an annual plan based on our strategic plan. I should also mention, in the middle of this, we're changing our fiscal year. We used to be based on calendar year. To align with the state and in the counties, we're now aligning to July 1st as our fiscal year. So so we have a short 6-month window. So last year we did an 18-month annual plan to get us through this 6-month period. So 12 months plus the 6 months. And then in this spring, we're going to focus on our annual plan based on our new strategic plan to start building out what the year looks like. And in that, we'll put a lot of metrics to measure how we're doing. And so it's I would say we're still a little rough on measuring the outcomes, but I think anecdotally, when we look at it, we see the benefits that these new tools and systems have had. But we need to get better at that.
Yeah. Yeah, no, I think that's so cool that you've taken a step back or a higher level of, like, how does this all blend together? Because certainly technology is a big component of that, but being able to, I like the reminder element. Hey, do you remember what it was like before this? But also the future facing element of, hey, this is what it can do, things that you don't even know yet, and certainly attributing a metric. Scott, I think if we don't have the word change in this podcast title, it would be a missed opportunity, because
Yeah,
everything
isn't
I've
that the
heard here,
truth?
a
Yeah.
fiscal year changes, that's already a massive project in itself.
Yeah. Well, and I was thinking, well, the other thing, like, I like to look at the future, and I'm a big technology. I love to looking at new technology, and clearly AI is a big thing that's here. When I think about and talk about the value that Agentforce will have for us, so that we can actually ask our data questions and get
Mhm.
information based on what our data says, that's going to be such a huge change. I can't wait for that kind of implementation, so that we can really dive into the data that we have. We have such a huge repository of information that really is difficult for us to access, other than just doing reports, and those reports aren't smart reports. So if we can use Agentforce to actually dive into and find new insights that we're not able to see just by looking at it daily, I think that'll be a huge win for us.
It's so refreshing to hear a customer talk about their excitement for Agentforce. I think there's an element of AI fatigue across some organizations, just in terms of, like, just the rate of change is so fast, and they, in many cases, they don't have a leader in that organization that's got the reins of sort of that shadow IT that everybody in our org we know is using AI, but are we all using it consistently, and are we all doing it the right way? And so it's just it's so exciting to hear your enthusiasm for change, and for what the opportunity is ahead, in terms of just being able to, I think, how you framed it is so well. Ask your data questions, like ask your system questions, and have it respond. Um, I just want to come back for a second, just to a problem that some organizations face. Does not sound like this was a problem for Valley Health Foundation, but that is just getting leadership and getting the board aligned on uh, the direction in terms of the investment, and then actually funding these projects. And you have bitten off not a bite of the apple. It's like you ate a entire bag of apples in one go here. And how did you get the board to fund this? How did you get the board to be excited about this massive pivot? I know that there was the problem that was acknowledged of like we can't scale. That can be true, but at the same time, there's not the support of the board to go and address it. So how'd you overcome that?
Yeah, I think we're, again, fairly lucky in where we are and the board members that we have. They understand the value of technology. A lot of them are at bigger corporations that use these tools, and they see the value that they get out of, using a Salesforce or a NetSuite. Also, I was on the board when we were making these decisions, and I could see that, one, we're fortunate that we were in a good financial position to be able to afford these updates and these changes because it's not cheap. Obviously, as you guys know, it costs a lot of money to hire the right people to do the right things so you can build the right tools. But our board was very supportive from the beginning. I mean, it was like, I think in many ways, there's probably a reluctance from a lot of nonprofits to not spend on these types of things, thinking that it's spending on themselves instead of spending outwardly. But I think if you flip it around and say, if we spend on ourselves now, it's going to help improve how we're able to manage
Yeah.
and grow and scale and help more people. So I think it'll improve the impact by having better systems. So I think, in many ways, I just think we're very fortunate that where we are.
Yeah. Yeah. Well, that's amazing. And I think it's you've phrased that of working on yourself or investing in yourself as an organization so that you can go and make a bigger impact. I think is a very logical way of thinking about it. But
Hmm.
it's you got to step out of the firefighting and move into more of the strategic, which you guys have certainly done.
As you brought that up, Tom, and I know you've had the benefit of being on the board, so you understand, and you're part of that decision-making process. And sounds like that approach would be similar had you even not even been part of the board as well. Just that, like being able to reflect this is where we need to go.
Yeah.
I was prompted with this kind of thought or image as you were describing how you've rolled out RAP, you've rolled out all of these different solutions and technical solutions here, but you're still focused on building as to the there's a misconception, I think, when you talk to leaders that you need to have everything kind of squared away and solved and figured out in order to start thinking about the future as well. And it sounds like you're doing both at the same time. You're planning for the future, but also getting things to a good baseline as well. Is that a true statement?
Yeah, I would say that I think what I've told the board is we're never going to be done. Like you're never finished with technology upgrades, right? Like we're always going to be looking for the new, better thing that's going to allow us to improve the processes we're doing the things that will help our beneficiaries and our donors. I mean, I have a whole list of tools I want to implement this year. There's always things we can do to improve and do better. So I think we're always looking for what are the things that are going to make the biggest impact to the people we serve, to the organizations we work with, who we partner with. And, from my perspective, the number one measure or metric that we should be looking at is how much it really moves that needle. How much do we impact those folks? And I would say our employees are a big part of that because, I'm a big believer in our employees having the tools and the resources they need to do their job well only improves the job they do and the impact they have out in the community even greater, right? So the better we can be at being buttoned up and organized and structured in a way that gives our employees the best step forward. I always say that my role is to kind of remove obstacles for people to allow them to do the best work of their lives. And so everything I'm doing is to try to always remove those barriers or the ways that they're impacted in the work they're doing. So
Yeah.
that's my focus.
Yeah, and I appreciate that folk. It's how can you serve your team? Equip them with the tools.
Exactly.
I'm curious, kind of speaking to some trends as well. So I figured you would have a list of tools that you're hoping to implement as well. I'm so curious what those tools are, but we won't get into that. I'm curious from your perspective, when you think about the landscape. So Valley Health sits in a pretty unique position as well, in that kind of that catch-all or that safety net, if you will. What are you seeing, maybe not technology-wise, but just landscape-wise, that Valley Health will have to evolve, be it the way that they operate, be it the way that they serve your team, but also their constituents? What types of things are you seeing out as you look around landscape wise that you'll need to respond to? Mm.
Yeah, I mean that's a great question because recently we've seen a major cut to our public healthcare system through HR1, the federal um, bill that was passed in July of this year of 2025, that basically cut $1 billion out of our county's budget for healthcare, and that is a major hit to our bottom line and how we operate as an organization. So, and I say as a healthcare system. So for us to have to step up and figure out how could we help there, one way we see that we can help, and one way we did help, was to be an advocate. And actually, we created a 501(c)(4), which allows us to raise political money. And we helped to get a measure passed in November that we raised $2.95 million that passed a tax measure that adds 5/8 cents sales tax to our local sales tax here in the county. And what that does, the impact of a $2.95 million round of investment means that we're going to turn that into $1.65 billion of return to the county over 5 years. So it's basically $330 million a year will go to the county for the next 5 years to help offset that $1 billion cut. So now we have to make up a $700 million cut. So it's still a cut. It's still going to be hurt. It's still going to be a tough challenge. But that shows the power of what a nonprofit can do to help really maximize or multiply the impact that we have, because that one measure is a huge, huge differentiator that probably kept a hospital open. So I just, that kind of stuff just makes me proud of the work we're doing, that we can find ways to help serve this community that needs the help. And that's our mission.
Yeah. Thanks for sharing. Yeah. I mean, I remember distinctly attending the fundraising gala as well, just the energy and the excitement around getting behind that. And I think that's really, really neat. Like, how do you move? There's technology, there's innovation. And I think, again, there's another misconception that just because you operate in a nonprofit, you can't think like, how can we continue to be innovative as well? And I think that's really cool, moving from technology to public advocacy and drumming up eyeballs, attention. Like, how do we scale? How do we 2x, 3x that impact to return
Yeah,
that $1 to $10 or
that's
whatnot?
right.
So that's,
Exactly.
yeah, thanks for sharing that. That's really
Yeah.
cool.
And another benefit of that, which we saw, was that it gave us the opportunity to really tell the public about the benefits of this public health care system that's theirs. I mean, this is built for them, and many people don't even know about it. So it was a great way for us to articulate the great work that this healthcare system is doing for everyone in our community. So it was a win-win.
Yeah, it's almost overcoming a bit of that perception and stigma too, that just because it's
Yeah,
public healthcare doesn't mean it can't be world class.
that's right.
And I know you've shared that, like some leading burn care, trauma, and whatnot. So
Yeah,
yeah, that's neat.
exactly.
Well, Tom, maybe the last question for you is, where is the organization going next? What's the next year or 2 years? I know you shared earlier you've got a 5-year strat plan that you're working through. But if we were sitting down over a coffee in a year's time, what are you most proud of?
Yeah, I think we've set a good course. I like the direction we're going, and I think our strategic plan is essentially saying, yes, we're on the right path. We need to focus on these things to continue going in that direction. Um, I would say that in a year, I hopefully will tell you that we've launched our fund management portal, that we have better invoicing that can include payment links and QR codes. And like, there's a lot of things that I think will, again, further enhance the operations of the organization that are still, to me, a little bit archaic in how we approach things, and there's ways for us to fix it. So there's still, to me, a lot of operational things we need to do as an organization. From an impact perspective, we hope to continue to grow the amount of money we're raising from our funders, and the number of people we're able to help through our beneficiaries. The impact we have in the community is first and foremost the reason we're here. So everything we're doing on operations side is to help increase the amount of impact we're having in our community. So I think we're on the right path. It's just keeping down that path and continuing to focus on the things we're doing to improve those outcomes.
I think that's a really good one to end on here, Tom. I mean, I just want to share appreciation for we've I've certainly told you this before, just the lens that you have and the excitement and the passion, it can be felt. It's contagious when it comes to change. And I think you've certainly this episode, again, we're going to put change in the title somewhere here. But just the way that you approach change, and it's the embracing of that change and the recognition that there's going to be bumps and lumps along the way, but being able to overcome that, I think is very refreshing to hear. So deep appreciation for you hopping on here and joining Scott and myself and just sharing its story. I think you're doing amazing work. Valley Health is solving a very tangible need, and we're excited to play a small part in that and seeing just the scale at which you can impact even more people. So thanks for hopping on today.
Absolutely. And thanks to you guys for the great work you're doing, because you guys have really helped us grow our Salesforce experience. And we're happy to have you as partners. I think that's an important part, is finding the right partner that you can scale with and grow with and help you achieve these different milestones that we've set for ourselves. Having the right partner makes all the difference. And so having Belmar as our partner has been a game changer for us. So we appreciate you guys as well.
Well, hey, we're grateful, and so thank you, Tom. If listeners want to get in touch with you, what's the best way for them to reach you?
valleyhealthfoundation.org is our website. Tom Zazueta is my name, and I think I have my link on there. So
All right.
happy to talk to anybody who wants to talk about healthcare, technology, whatever. I'm happy to talk to people.
There we go. Awesome. Well, thanks for making that offer, and thanks for doing this. We're super
Appreciate it.
grateful, and can't wait to get together again soon. And hopefully it's less than a year, and we can talk about the wins that are going on. But really
Yeah.
appreciate you doing this, and thanks for your time, and thanks for the commitment to the community and just the great work you guys are doing.
Thanks so much, Scott. Thanks, Matt.
All righty.
Take care.
You're listening to the Belmar Bites podcast, brought to you by Belmar Consulting.